Sepsis is a potentially life-threatening condition caused by a dysregulated host response to infection. Sepsis and septic shock are major healthcare problems affecting millions of people around the world each year and killing as many as 1 in 4. Early identification and rapid appropriate management in the initial hours after sepsis develops improves outcomes. In 2002, the European Society of Intensive Care Medicine joined with the Society of Critical Care Medicine to spearhead the Surviving Sepsis Campaign. The campaign had several aims, namely the reduction of mortality from sepsis through development of guidelines for diagnosis and treatment. The SSC has documented the aim that sepsis mortality can be reduced by 25% when implementing the guidelines and the bundle. These evidence-based guidelines are updated every 4 years and have been translated into several languages. ESICM and SCCM have provided general funding for the campaign, including support for the guideline updates starting in 2008. No direct or indirect industry funds have been nor will be used for the Surviving Sepsis Campaign guidelines and bundle development. The most recent Surviving Sepsis Guidelines provided 93 recommendations on early management and resuscitation of patients with sepsis or septic shock. These recommendations follow a strict methodology and are developed by a consensus committee of 55 international experts with 25 international sponsoring organizations following the highest standards. Overall, there are 32 strong recommendations, 39 weak recommendations, and 18 best practice statements. The guidelines are the foundation from which the bundle is formed. The Surviving Sepsis Campaign, SSC, has released a new, updated Hour 1 bundle to reflect the latest evidence from the International Guidelines for Management of Sepsis and Septic Shock 2016. The bundle is intended to provide the most critical steps for immediate intervention upon presentation of sepsis. Recommendations in the 2016 guidelines and in the Hour 1 bundle are intended to provide guidance for the clinician caring for adult patients with sepsis or septic shock. Pediatric guidelines are in development. It should be noted that recommendations from the Surviving Sepsis Campaign guidelines are not intended to replace the experienced clinician's judgment when presented with a particular patient's unique set of clinical variables. Rather, the guidelines integrate identified decision points and courses of action that, when combined with clinical judgment, can make a difference in patient outcomes. For more details on the campaign and to download the guidelines, the Hour 1 bundle and other resources, visit www.survivingsepsis.org.